Nurse Ada, what is heart failure? A heart failure is a condition where the heart is unable to pump enough blood to satisfy the body's need for blood, oxygen, and other nutrients. Sometimes we can just say heart failure is having a weak or a stiff heart. What causes heart failure? A heart failure happens when the heart muscle is too weak to pump enough blood to the body. This is the case when the ejection fraction of the heart is reduced. Another cause of heart failure is when the heart muscle is thick and stiff. It does not relax enough to be filled with blood. What is ejection fraction? The ejection fraction is a measurement of the percentage of blood leaving your heart each time it squeezes or contracts. It is the percentage of blood that is pumped out of a filled ventricle with each heartbeat. The normal ejection fraction is about 50 to 75%. 40 to 50% is borderline heart failure. The ejection fraction can be measured by echocardiogram, cardiac catheterization, MRI, CT scan, and nuclear medicine scan. What are the signs that we have heart failure? The symptoms of heart failure are shortness of breath, fatigue, and edema. The most common symptom of heart failure is shortness of breath. The shortness of breath in heart failure is caused by the decreased ability of the heart to fill and empty, producing elevated pressures in the blood vessels around the lung. The person will have difficulty of breathing when lying down. This is a specific symptom of heart failure. The person uses many pillows to breathe. He wakes up from sleep at night with shortness of breath and sit up to catch his breath. He coughs at night or when lying down. He gets short of breath with activity. Another sign of heart failure is swelling of ankles or legs and fluid weight gain. This is what we call edema in medical term. These symptoms are the result of fluid retention and poor forward flow of blood out of the heart. So in short, there is congestion. That is the reason why it is also called congestive heart failure. Another sign of heart failure is fatigue. The person gets tired easily. Depending on what stage of heart failure the person is on, the fatigue will get worse as the heart failure progresses, until he can no longer do any activity. Since you mentioned about stage of heart failure, what are the stages of heart failure? The American Heart Association and New York Heart Association stage the heart failure. The American Heart Association stage heart failure into A to D, while the New York Heart Association stage it into 1 to 4. In American Heart Association, stage A and B are the being at risk for heart failure. Stage C and D are having symptoms. The implication of these stages is that they represent a forward progression. The person can maintain in the same stage for a longer period if he will follow the treatment guidelines, but he cannot go back to the baseline stage once he's already on the more advanced stage. Staging in New York Heart Association is different than American Heart Association. Stage 1 is no limitation of physical activity, and an ordinary physical activity does not cause undue fatigue, palpitation, and dyspnea, or shortness of breath. In Stage 2, there is a slight limitation of physical activity, comfortable at rest. Ordinary physical activity results in fatigue, palpitation, and dyspnea. In Stage 3, there is marked limitation of physical activity. Comfortable at rest, less than ordinary activity causes fatigue, palpitation, and dyspnea. In Stage 4, the patient cannot carry on any physical activity without discomfort. Symptoms of heart failure: at rest. If any physical activity is undertaken, discomfort increases. How can you develop a heart failure? There are two types of heart failure: the right-sided heart failure and the left-sided heart failure. Under the left-sided heart failure, there are two causes: the systolic and diastolic. In systolic heart failure, The lower left chamber of the heart or the ventricle gets bigger or enlarges and cannot squeeze or contract hard enough to pump the right amount of oxygen-rich blood to the rest of the body. This type of heart failure means the heart is weak. In the beginning, the heart muscle may try to make up for being weak by stretching out and getting larger, but this only helps for a little while. The heart will become weaker over time. As a result, the ejection fraction will go down and it's usually below 40%. In diastolic heart failure, the heart cannot fill with enough blood. The heart pumps or squeezes normally, but it is still stiff and does not relax properly. A stiff heart cannot fill with enough blood to send to the rest of the body. The heart muscle may try to make up by developing more muscle mass to make it thicker. It will improve the contracting cells in the heart muscle initially, but it will just help for a while. What happened in diastolic heart failure is this: the pressure in the upper chamber will become higher. The pressure in the left atrium and pulmonary vascular will increase. This will then cause a problem to the right side of the heart. In the beginning of diastolic heart failure, the ejection fraction is normal, but eventually will go down as the problem will progress. Now let's discuss the right-sided heart failure. First, we will discuss the heart circulation, so you can understand what's going on. The heart is divided into two sides, the right and the left. First, the blood will enter the right side of the heart. The unoxygenated blood from the body will enter the right atrium, then to the right ventricle. It goes to the lungs for oxygenation, then to the left side of the heart, which is the left atrium and the left ventricle. But if the left side of the heart failed, it will affect the right side, because when the left ventricle fails, it increases the fluid pressure and will affect the lungs, then eventually affects the right side of the heart. That is the reason why right-sided heart failure usually occurs as a result of left-sided failure. When the right side loses pumping power, blood backs up in the body's veins. This usually causes swelling or congestion in the legs, ankles, and swelling within the abdomen, such as the GI tract and liver, causing ascites. When you are on the process of heart failure, the body will do anything to help. The heart will also pump faster in an attempt to circulate more blood throughout the body. The body also tries to compensate in other ways. The blood vessels will narrow to keep the blood pressure up, trying to make up for the heart's loss of power. The body diverts blood away from less important tissues and organs, like the kidneys, arms, and legs, to supply the heart and the brain. Although the body's ability to compensate for the failing heart initially is beneficial, they don't solve the problem. Heart failure continues and worsens until these compensating processes no longer work. Eventually, the heart and body just can't keep up. For example, an enlarged heart eventually doesn't function as well as a normal heart, and the extra muscle mass adds stress to the entire cardiovascular system. The organ systems from which blood has been diverted may eventually deteriorate because of an inadequate supply of oxygen. Narrowing of the blood vessels limits the blood supply and can contribute to conditions such as stroke, heart disease, and clogged or blocked blood vessels in the legs and other parts of the body. Pumping blood too fast for too long can damage the heart muscle and interfere with its normal electrical signals, which can result in a dangerous heart rhythm disorder. What are the specific diseases that causes heart failure? The causes of heart failure are CAD or coronary artery disease, high blood pressure, heart valve problems, arrhythmia or abnormal heart rhythm, like when it's too fast, too slow, or irregular, diabetes, heart defects at birth, obesity, severe lung disease such as chronic pulmonary disease or COPD, enlarged heart, inflammation of the heart muscle or myocarditis, aging, chronic kidney disease, alcohol abuse, drug abuse, virus, and other infections. Can you please explain why CAD can lead to heart failure? In coronary artery disease, there is a plaque buildup inside your coronary artery. The coronary artery is the one supplying oxygen and nutrients to your heart. When the blockage will become complete, you will have a heart attack. A heart attack will cause the tissue of your heart to die. When this happens, the healthy tissue will take over the task of pumping blood. This will cause burden to your heart. It can weaken the heart muscle and eventually cause heart failure. How can a high blood pressure lead to heart failure? In high blood pressure, the heart is working so hard to push the blood against the walls of the arteries. Over a long period, it can weaken the heart and lead the heart's muscle cells to become thick and stiff. How about cardiomyopathy? How can cardiomyopathy lead to heart failure? Cardiomyopathy is a disease of the heart muscle that makes it harder for the heart to pump blood to the rest of your body. In cardiomyopathy, the heart muscle is enlarged, thickened, and rigid. So over time, the heart will get tired and become weaker and less able to pump blood through the body. This can lead to arrhythmia or abnormal heart rhythm, heart valve problems, and eventually heart failure. How can diabetes cause heart failure? In diabetes, the body does not make enough insulin or does not use its insulin properly. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin helps the blood sugar enter the body's cells, so it can be used for energy. But since there is not enough insulin, or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, high blood sugar levels can damage and weaken the heart muscle and the blood vessels around the heart. This will cause stiffness of the ventricles and eventually can lead to heart failure. Oftentimes, diabetes also has high blood pressure. As what we have discussed, high blood pressure can weaken the heart. How do you manage heart failure? Heart failure cannot be cured, but you can control with proper treatment. With the use of medications and proper treatment, patients can prolong their lives. We cannot go back to the baseline stage, but we can improve the functional capacity of the patient with the help of medications and treatments. We can manage heart failure into two strategies: pharmacologic and non-pharmacologic. Pharmacologic means we use drugs. In pharmacologic, there are many drug options. We can use diuretics, ACE inhibitors, beta blockers, and inotropic agents. Examples of non-pharmacologic interventions are dietary sodium and fluid restrictions, physical activity as appropriate, and attention to weight gain. The current guidelines on diagnosis and treatment of chronic heart failure are the following. Patients will monitor their weight, carry out daily physical activities that do not induce symptoms, alter their dietary intake of salt, and make healthy eating choices, encourage taking prescribed medications, stop smoking, and reduce alcohol intake. The fluid buildup and swelling can restrict blood flow to the kidneys. Because of this, the kidneys will produce hormones. These hormones can cause the kidneys to retain salt and water, which results in weight gain. This is the reason why we wanted the patient to weigh themselves daily and should be alarmed when they are not be able to tie their shoes and when their clothes become tighter. Another way to monitor fluid retention is to check swelling in the lower extremities and abdomen. It is important to prevent fluid overload because if there are too much fluid in the body, the heart will work hard to pump. Over time, the pumping action weakens. Sodium attracts water. That is the reason why their diet should be low in sodium. And as I said, we don't want fluid overload because the heart will work hard. To avoid high sodium foods, avoid prepackaged foods. Prepackaged foods has high in sodium. Example of prepackaged foods are cheese, processed meat, canned foods, and baked goods. When the patient is still smoking, counsel him or her to quit. Smoking will just worsen his or her condition. It's because of the nicotine content. It narrows the artery and increases the blood pressure. It can also harden the arterial walls. If he or she takes alcohol, advise him or her to control or quit. It's because alcohol is a stimulant. It can increase the heart rate and induces abnormal rhythm of the heart. Heart failure is usually a chronic or long-term, a condition that gradually gets worse. By the time most persons notice its symptoms, the heart has been failing, little by little, for a long time. So to prevent heart failure, you need to have a regular checkup with your doctor. The doctor can detect signs of heart failure before you experience symptoms. Heart failure rarely occurs suddenly, except after a major heart attack, severe heart valve problem, or period of seriously high blood pressure. Thank you, Nurse Ada, for the informations. I learned a lot today. You are welcome, Jenny. To all my viewers, thank you for watching. If you haven't subscribed to my channel yet, press subscribe and the notification button in my YouTube channel. Follow me in Facebook. Thank you for your support.